So our next speaker is going to be Steve Teitelbaum, who's going to talk about some non-surgical alternatives. Steve?
UltraShape, a different idea, totally non-invasive, using focused ultrasonic energy that creates fat disruption through cavitation, not through thermal injury, at a controlled depth. As the photograph shows, you see disruption of the fat cells, but the blood vessels and other tissue are unharmed at that depth. We know that the pulses are going where we want them to go and that we're not repeating them because it uses an overhead video camera with a computer simulation, so it tells you exactly where the energy is being delivered. This has already had 3 peer-reviewed and published papers, and this started out, this technology, at Hot Topics. That's where I learned about it, and has put the horse before the carriage by always having prospective, good data in advance of any clinical claims. This is the new machine on the right that looks a little different than others that you might have seen in the past. The treatment times are 30 to 60 minutes. Patients lay there and talk without any discomfort. They drive in, they drive out, they look the same, they go back to work. Within 2 weeks, the results are seen. There are now 700 machines in 57 countries, again, not in the United States. 150,000 patients have been treated worldwide, and the worst adverse events so far were very minor blisters that healed without scarring, and that's occurred in less than 0.5% of the treatments. Through a number of studies I'll mention in a moment, the average reduction in each of a number of studies have been 3.5 to 6.3 centimeters in circumference, and patient satisfaction in those studies has ranged between 86% and 94%. This is a validated computer simulation of what this does. At the very top where it says transducer surface, that's at the skin. This shows that no energy is delivered in any significant quantity at the skin, but that pressure, which is really what the effect is of ultrasound, is at a high cavitation creating level as seen in the center of this diagram. Looking at this surface in a polyacrylamide gel manner model, you can see that cavitation does occur, but that there is no cavitation at a more superficial depth, validating that this can deliver high and effective fat-destroying energy beneath the surface of the skin so that the skin is protected and not damaged. Here in porcine models, in which on the left is a control, in the middle is I almost said patient, is a pig sacrificed immediately after a single pulse, you can see the cavitation effect on that tissue. And note above the red circle, again, you see no damage to the more superficial tissue. Of interest on the right is a new energy settings and a new head that the company is developing, demonstrating that there's the potential for even greater clinical effect than has been demonstrated to date. On the left is the control, and on the right you can see the fat disruption. And if you look carefully at the sharp edges, you see that there's of the septi between the cells, you see that this is no evidence of any thermal injury at all, but that this is the result of fat lysis. In a close-up of the same photograph, you see that there's fat disruption around blood vessels and nerves, but that blood vessels and nerves within it are not affected by cavitation the same way as adipocytes, so that those tissues appear to be preserved. This is an interesting new slide in which on the upper left, you see what an untreated pig looks like, and if you go down going down that column on the left, you see a single treatment showing cavitation, but then if that same pig is harvested 2 weeks later, it's completely healed. If you go down one more, that's a pig that's had one treatment, 2 weeks later got another one, again is healed 2 weeks later. And the point of this is this validates that the healing process is relatively rapid, so that within 2 weeks the tissue returns to normal and can receive another treatment, so that successive treatments for additional improvement are possible and safe within a short period of time. In addition, this shows that if you look at the tissue at 2 weeks, you already see good healing as evidenced histologically with return of collagenous tissues and no evidence of inflammation at that time. There have been a number of clinical studies, 2 of which have been published in peer-reviewed journals, and a number of other studies that have been presented at meetings all around the world. The conclusion of these multiple studies have looked at 550 patients. For the last 3 years, they've consisted of 3 treatment regimens at those 2-week intervals I've mentioned, 3.5 to 6.3 centimeters in circumference reduction, with a mean in that of 4.4 centimeters. 94% of patients have response, 6% don't, and average patient satisfaction has been 90%. The US IDE clinical study It was headed up by Dr. Kenkel. There were 6 clinical sites. I was the medical monitor of the study. This is with a new head that had a reduced pulse duration from earlier models and has an improved transducer. They looked at 125 patient abdomens, giving 3 treatments 2 weeks apart, taking pre and post MRIs. They did comprehensive blood studies, very standardized photographs I'll show you, and looked at independent blinded MRI and photographic assessment. The patients have now been enrolled. It has been unblinded, and the safety endpoints have been all achieved with no serious adverse events and no changes in blood chemistries. We expect an efficacy analysis in the next month. And this shows the very carefully done photographic technique which we can use to really look at the results. So I think I've discussed 2 very exciting, not yet available technologies, one just injection, one totally non-invasive. Thank you very much.